Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this week's video. In this week's video, we're in session number 6, our final session of our ongoing program entitled Cumulative Trauma and the QME. And I have a fascinating discussion for you today that will help you in your very next evaluation, wherein you're called in as the Qualified Medical Evaluator to render an opinion on industrial causation, that is either for or against industrial injury in a denied claim that involves an allegation of cumulative trauma. And this is going to put the finishing touches on this 6-hour program that you can find nowhere else. You know, I'm sure you'll agree with me that if you go to a live QME continuing education seminar, you may be lucky to receive 30 minutes, maybe 60 minutes, if any time at all, on the important topic of cumulative trauma and cumulative injuries. And in discussing this with qualified medical evaluators, it seems that qualified medical evaluators have a difficult time wrapping their mind around the concept of a cumulative trauma injury. And it's that very reason that I decided to create and to present this program. And before we get into the important topics that I want to share with you today, let's just review briefly where we've come from so far in this program. In session number 1 of this program, we talked about what constitutes an injury in the California workers' compensation system. And it's fascinating that qualified medical evaluators have told me that this very single discussion has helped them tremendously and has tremendously simplified their complex medical decision making in these difficult determinations on AOE COE regarding cumulative trauma injuries. So it's important to remember that before we can have an industrial injury, okay, before there can be an industrial injury, there must first be an injury. And many examinees that we evaluate do not have an actual injury as an injury is defined in the California workers' compensation system. So the first obligation of the qualified medical evaluator before even establishing the presence or absence of an industrial injury is determining the presence or absence of an injury. And we talked at great length about that in our first session. In our second session, we talked about how establishing the date of injury is critical for both specific and cumulative trauma injury claims, and it's some subtle nuances in the language of the date of injury under Labor Code 5412 that creates tremendous opportunity and a tremendous window through which thousands and thousands of claims for cumulative trauma injury can be filed. And it has to do with a loophole in the language of what constitutes the date of injury for a cumulative trauma injury claim compared to the date of injury for a specific injury claim. We then talked about what constitutes a bona fide and legitimate reporting of a claim, because all examinees will tell you in the face-to-face evaluation that they reported the claim. In some way, shape, or form, they reported the claim. Well, the reporting of claims is described in Labor Code 5400 and 5401, and whereas Labor Code 5400 creates a very strict and objective requirement, a hard requirement for a written report from the employee, Labor Code 5401 comes right behind it and greatly softens the requirement for a reporting of an industrial injury so that almost any inference, reference, or implication from an employee to any person in authority at the workplace can constitute a bona fide and legitimate and legal reporting of that claim that can allow, therefore, the claim to then move forward. In our third session, we built upon those topics and we introduced the concept of the post-employment cumulative trauma injury claim. And this is going to be comprising a large bulk of the next evaluations that you're going to be seeing over the course of the next 12 months at least, and even into the future. And Labor Code 3600 generally bars, bans, prohibits, blocks, and prevents the filing of claims for industrial injury, both specific and cumulative, after the employee has separated his or her relationship from the employer. Now, these employment separations take two varieties, come in two varieties. Number one are those situations where the employer has initiated the separation. In other words, the employer has either fired or laid off the employee, or the employee can initiate the separation in the form of quitting, in the form of taking a leave of absence, in the form of retiring, in the form of taking a sabbatical. So either the employer or the employee can initiate the separation, and the law deals with these types of separations differently. Now, when the employer initiates the separation, such as in a termination or a layoff, Labor Code 3600 prevents employees from filing a claim for industrial injury after the employment relationship has ended. However, don't you know, there's 4 exceptions to the so-called post-termination defense under Labor Code 3600 that do allow cumulative trauma and specific injury claims to fly, even when those claims are filed in the post-employment period. And we talked about how to spot each of those exceptions when those exceptions are operative in the evaluations that you're called upon to perform, because these claims can only fly when the employee is able to successfully capture and exploit one or more of the exceptions. In our 4th session, we built upon even those concepts by sharing with you several case examples that illustrate how the date of injury for a cumulative trauma injury claim comes into play when the claim for industrial injury has been denied by one or more insurers. Now, establishing the date of injury for a cumulative trauma injury claim is critical because many times the exposure period over which the cumulative trauma is experienced by the employee, the exposure period many times involves one or more insurers. So establishing the date of the cumulative trauma injury claim establishes who's liable for the benefits. So we talked about how the disability and the knowledge that the disability was caused by the workplace activities, how these two criteria under Labor Code 5412, how those two criteria collide and coincide to establish the date of injury, and that was a fascinating discussion. And each of these cases provided a different twist on the application of the date of injury under Labor Code 5412. In our last session, we talked about some fascinating statistics that are known about cumulative trauma injuries in the state of California, and fascinatingly, it's known where in the state of California cumulative trauma injury claims are coming from and are growing, who in the state of California is filing claims for industrial injury, especially cumulative trauma injury, and in which industry sectors the growth of cumulative trauma injury claims are being concentrated. And specifically, cumulative trauma injury claims have exploded in Los Angeles and San Diego counties, and have exploded in both the manufacturing and hospitality sectors, and have exploded for employees with average weekly wages below $500 per week. So it seems to be the low income wage earners in hospitality and manufacturing in Los Angeles and San Diego counties wherein cumulative trauma injury claims are exploding. And then we talked about the Robinson case, which was fascinating for us as qualified medical evaluators because it gave us some insight as to how cumulative trauma injury claims are decided in the courts. And in the Robinson case, the qualified medical evaluator was found to have an inadequate understanding of the concept of a cumulative trauma injury, and for that reason, he was discharged as the medical evaluator in that case. Well, some of the principles from that case are going to be important to us in today's discussion as we get into our causation analysis and some of the thought-making process and medical decision-making algorithms that you can employ and can rely upon when it comes time for you to render an opinion either for or against industrial injury in these cases that involve allegations of cumulative trauma injury, especially when those allegations are filed in the post-employment period, and most especially when those claims have become denied by the claims administrator. So with that as our introduction to the program, let's get into the topics of today's discussion, which has to do with your causation analysis in the determination for or against industrial injury. Okay, so let's talk about the causation analysis in a denied claim for cumulative trauma injury. Now, it's important to remember that when you're called upon as the qualified medical evaluator to render an opinion either for or against industrial injury, you're going to be providing what's referred to as an AOE-COE determination. Well, it's important for us as qualified medical evaluators to understand the distinctions between AOE and COE. And as you know, AOE stands for arising out of employment, and COE stands for occurring in the course of employment. Now, it's important to remember that qualified medical evaluators do not opine on COE. Whether or not an industrial injury occurred in the course of employment many times boils down to a question of fact. And questions of fact are resolved by the triers of fact. And the triers of fact are the judges. Qualified medical evaluators do not opine on COE. How can a qualified medical evaluator make a statement that an injury occurred in the course of employment when the qualified medical evaluator was not present at the place of employment? Okay? So qualified medical evaluators do not opine on COE. Now, the judge, in rendering his COE opinion, relies in part on the AOE opinion of the qualified medical evaluator. So one of the pieces of information that the judge will use in synthesizing his final determination, either for or against industrial injury COE, is the AOE opinion of the qualified medical evaluator. So let's talk about the AOE determination. With the AOE determination, the question that you're being asked, basically, this is basically what it boils down to, is whether or not it is reasonably medically probable, in other words, that there is a 51% or greater likelihood, okay? It doesn't have to be a 100% certainty, okay? It's not an absolute certainty. Actually, the AOE determination involves several low thresholds, and this is one of them, that it's reasonably medically probable. It's only 51% likely that the workplace duties, as those duties were described by the examinee, could have contributed. Okay, do you see these low threshold words? Could have contributed to a significant degree, another low threshold term, to the pathologic condition or the disability that the physician is describing. Now I want you to think back to some of the cover letters that you received from the parties. Many times the cover letters that we receive all follow the same format. They ask the physician, number one, what is the diagnosis? What's your diagnosis of the examinee's condition? So here, what is the pathologic condition or the disability that you as the qualified medical evaluator are describing? So in order to qualify as an industrial injury, there must first be an injury. And the injury is described here by the term pathologic condition or the disability. So for you as a qualified medical evaluator, you must clearly define the condition and or the disability that the examinee is experiencing. Once that's established, the question becomes, is it reasonably medically probable that that condition or that disability could have been contributed to? Doesn't have to be the sole cause, has to only be contributed to a significant degree by the workplace duties as those duties were described to you by the examinee. So the examinee will come to you and then tell you about how they injured their lower back at the workplace by doing various activities. Your obligation then as the qualified medical evaluator becomes to determine what is the condition, what is the pathologic condition of the examinee's lumbar spine, or what is the disability that the examinee is experiencing as a result of injury to the lumbar spine. Okay, so you must establish the condition and or the disability. And then number two, is it reasonably medically probable that that condition and that disability could have been contributed to a significant degree by those workplace duties? In other words, are the workplace duties consistent with that type of a condition or with that type of a disability? Okay, so let's explore this a little bit further. So in arriving at an accurate AOE determination, there's three basic considerations that you want to include in your medical decision-making algorithm. Number one, what pathologic condition and or disability is present? Remember that the AOE determination basically boils down to answering the question as to whether or not, within reasonable medical probability, the workplace duties, as those were described by the examinee, could have contributed to a significant degree to the pathologic condition and or disability that you as the physician are diagnosing and or describing. So let's focus on number one, the pathologic condition. This is where your expertise as the qualified medical evaluator is critical, and the parties rely upon your expertise to define what is the pathologic condition that's present. So remember, according to the definition of injury in California workers' compensation, the examinee must have a bona fide, diagnosable, active, and symptomatic condition first criteria to qualify for an industrial injury. So you as the qualified medical evaluator must clearly define and describe the pathologic condition and or the disability that the examinee is presenting to you with. Okay? Now many times, and this is according to the ACOM guides on page 87, many times the conditions that the examinees present to us, even though they present to us with conditions, those conditions do not qualify as an injury is defined in California workers' compensation. So to review from session number one, in order to qualify as an industrial injury, a condition, a bona fide, active, symptomatic, diagnosable condition must either cause disability and or a need for medical treatment. If the examinee has a bona fide, diagnosable, active, and symptomatic condition, but that condition does not cause disability or does not cause a need for medical treatment, that condition does not rise to the level of an industrial injury. And the ACOM guidelines describe this very clearly on page 87. They tell us that the evaluator's obligation is to assess whether or not a worker's symptoms are truly representative of an injury per se. In other words, whether they require medical treatment and or are causing disability, or simply reflect a normal musculoskeletal response following the performance of an activity to which the worker was unaccustomed. And this is critical for us to understand, especially in the context of cumulative trauma injury claims, where employees are claiming injury as a result of repetitive, physically demanding activities extending over a period of time. Many times these repetitive activities are simply activities that the examinee is unaccustomed to, for which they are experiencing a normal musculoskeletal response. And that normal musculoskeletal response in the form of pain, weakness, soreness, stiffness, is not something that's expected to respond to medical treatment. It is not something that is causing disability, and therefore does not qualify as an industrial injury as that's defined in California workers' compensation. So this is just an example. You may have a different situation wherein the examinee has a bona fide pathologic condition. It's a diagnosable condition. It's active. It's symptomatic. And it is causing the examinee disability, or it is causing the examinee a need for medical treatment. And that's, in that scenario, your opinion on AOE, COE would be yes. Yes, you can state with certainty that it is reasonably medically probable that the workplace duties as described to you by the examinee are contributing to a significant degree to the pathologic condition, and the condition that the examinee is presenting to you with is not simply a normal musculoskeletal response to unaccustomed activity. Okay, so I gave you examples on both sides of the coin, but your first obligation as a qualified medical evaluator is to clearly describe and define what is the pathologic condition and or the disability present or absent. Once the pathologic condition and or the disability is clearly described and defined, then you can go on to the next step in your medical decision-making algorithm regarding an opinion either for or against industrial injury. So again, the AOE determination boils down to whether or not, within reasonable medical probability, you can say that the workplace duties, as those duties are described to you by the examinee, could have contributed to a significant degree to that pathologic condition that you've identified, defined, and described. So once the pathologic condition is identified and described, then you can move into your occupational history to investigate the workplace duties and the association of those workplace duties with the pathologic condition that the examinee is presenting to you with. So some of the considerations that you want to factor into your algorithm include: what is the relevant workplace exposures that were present to result in a cumulative trauma type of injury to the examinee? What was the kind of exposure? And typically in dealing with neuromusculoskeletal conditions, we're going to be dealing with repetitive motions, repetitive activities. So this is where in the occupational history section of your report, you clearly and accurately describe the type of repetitive activities on a cumulative basis that are reasonably contributing to a significant degree to the pathologic condition that you have identified. You're going to want to provide details about the level, the frequency, and the duration of the exposure. And once these details regarding the exposure are clearly defined and described, then you can then settle about the decision as to whether or not the symptoms or the pathologic condition that the examiner is presenting to you with are reasonably medically probably contributed to a significant degree. In other words, those symptoms are either consistent or they're not reasonably medically probably contributed to any significant degree. In other words, those symptoms are inconsistent with the occupational exposure and or the pathologic condition that the examinee is presenting to you with. And again, you only have to make your determination in one direction or the other within reasonable medical probability. So you can say, in my opinion, within reasonable medical probability, the symptoms that Mrs. Jones is reporting with her lumbar spine are not consistent with the workplace duties, or in the alternative, you can state in your AOE determination, in my opinion, within reasonable medical probability, the symptoms that Ms. Jones is presenting and describing with regards to the lumbar spine are consistent with the workplace duties of repetitive and cumulative trauma motions, of working on the assembly line or in working on the loading dock, etc., etc., etc. So it's these types of details that go into your AOE determination as your determination involves and investigates the workplace duties. Okay, so if we have an examinee who we determine has a bona fide, active, symptomatic, and diagnosable pathologic condition, and we opine that within reasonable medical probability, that pathologic condition is reasonably contributed to a significant degree by the workplace duties, then we have the potential for a bona fide industrial cumulative trauma injury claim. The final consideration in your medical decision-making algorithm has to do with other causes. What other causes, what other personal factors, what other comorbidities, what other non-industrial causes may produce the disease or the pathologic condition that the examinee is presenting with. And this raises an important concept, the concept known as false imputation. False imputation. I wonder how many of you have heard of the concept of false imputation. False imputation occurs when an examinee presents to you with a bona fide condition. So they have a bona fide, actual, diagnosable, symptomatic, and active condition. Isn't that part of our determination on the AOE determination? It is. So the examinee meets the criteria of having a bona fide, symptomatic, diagnosable condition, but that condition is caused by a false cause imputed by the examinee. In other words, the examinee could suffer an injury playing soccer, but imputes the cause of the injury, imputes the cause of the bona fide, symptomatic, diagnosable condition to an incident that occurred at work, when in all reality the examinee knows that the injury was caused by playing soccer. This is the concept of false imputation, and this is what you're investigating with this final consideration in your medical decision-making algorithm. What other causes could produce the pathologic condition being described by the examinee? Now, the danger with false imputation and the hazard that we face as qualified medical evaluators is that examinees who are employing false imputation testify very, very credibly, because when they testify, they're telling you about a condition that they actually have. So they can tell you about their subjective complaints. They can tell you very credibly about their limitations to activities of daily living. And they can testify very credibly about the pathologic condition, because the pathologic condition is real. But your determination as the qualified medical evaluator has to do with causation, industrial causation of that pathologic condition. So a couple of additional considerations for you in determining the work relatedness or the work contribution, the work causation of that pathologic condition has to do with a couple of temporal, time-related considerations. So first of all, is there a temporal association between the exposure or work factor and the health concern? For example, the exposure must precede the disease. And this makes sense. And many times there's a one-to-one or there's an immediate temporal association between the workplace exposure and the health concern. So for example, you have an examinee who slips off of a stair today, and 2 hours later on the same day develops swelling of the ankle, bruising of the ankle, and a gait derangement due to pain in the ankle. And there's a strong temporal relationship between the exposure or the workplace incident and the pathologic condition presented by the examinee. Now contrast that with the other scenario where there's a loss of temporal relationship, such as an examinee, and I'm evaluating this very case within this week, is an examinee who presents for first medical care in January, and reports a pathologic condition due to an incident that occurred the prior September. In other words, 4 months prior to the first medical treatment, the examinee reports an incident 4 months prior that's responsible for the pathologic condition 4 months later. Now specifically, this is an examinee who woke up one morning, had difficulty getting out of bed, and reported for medical care. And at her first medical appointment, she reported that 4 months earlier, she had a slip and fall at work, and that her current difficulty in standing up and getting out of bed is due to the slip and fall injury that occurred at work. And this is a loss of temporal relationship. There's no way to state within reasonable medical probability in the AOE determination. No qualified medical evaluator can state within reasonable medical probability, that is, that the difficulty getting out of bed and difficulty in standing up straight in January is in any way related to a slip and fall injury that occurred 4 months earlier, and there's a loss of temporal relationship. So this is something that applies strongly to specific injury claims. More relevant for cumulative trauma injury claims is the concept of reversibility, and this is particularly applicable for neuromusculoskeletal types of injuries. The concept of reversibility, and this comes from the ACOM guidelines, tells us that tissue abnormalities, pathologic conditions in the tissues, typically resolve or reduce or improve with cessation of exposure. And this is particularly important for cumulative trauma types of injuries. So for example, examinees will tell you that they work all week, and by Friday they're a wreck due to the repetitive, physically demanding activities throughout the course of the week. They're typically a wreck, but over the weekend, when they have a cessation of exposure to the repetitive activities, by Monday morning they typically feel a whole lot better, and then the cycle repeats as they continue their exposure over the next business week. Or sometimes examinees will tell you that they went on a 2-week vacation, and while they were on a 2-week vacation they felt great, but then when they came back to work after the 2-week vacation, the whole cycle started to repeat itself, and this is the concept of reversibility. So with examinees who come to us with cumulative trauma injury claims, especially those that are filed post-employment, sometimes these claims are filed months after the last exposure to the workplace duties. Well, we would expect some reversibility of symptoms and some reversibility of that pathologic condition as more and more time passes following the exposure to those injurious workplace duties. So these are all some considerations that go into your medical decision-making algorithm that will allow you to opine within reasonable medical probability, either for or against industrial injury. So regardless of which way you opine, either for or against industrial injury, it's important that you fashion your argument within the body of your report in such a way that that opinion qualifies as substantial medical evidence. So let's talk a little bit about that now. Now, in providing your AOE opinion on industrial injury, either for or against industrial injury in a denied cumulative trauma injury claim, the trier of fact can use and can only use your opinion if your opinion rises to a certain level. Your opinion has to meet certain criteria in order to qualify as an opinion that the trier of fact can use. And the trier of fact can only use opinions and conclusions that qualify as substantial medical evidence. So let's talk about this for just a minute. When the trier of fact, which is the judge, looks at your opinion on causation, on your AOE opinion, and this applies to any opinion or conclusion that you offer within the body of your report, any opinion or conclusion that you offer in the body of your report must meet a certain criteria. It must meet the criteria of substantial medical evidence. So the first thing that the judge looks at when he looks at your opinion is he looks at your opinion to see if your opinion qualifies, first of all, as a substantial opinion. Before the judge looks at the content of your opinion, before the judge looks at the conclusion of your opinion, the judge first examines the form and format of your opinion to confirm that your opinion qualifies as a substantial opinion, and then the judge looks at the content of the opinion. So first, your opinion must qualify as a substantial opinion before the content of your opinion can even be reviewed by the parties. It's kind of like establishing a criteria for basketballs in a basketball game on the playground. I'm just making this up, but imagine you had a rule that only yellow basketballs can be used on this particular playground. Well, you can examine from a great distance whether or not the balls being used on that playground are yellow balls. And if you see a ball that's a red ball, you can instantly identify that as a ball that does not qualify or is not appropriate for the particular court that that ball is being used upon. Similar type of analogy applies to your opinions in the work that we do. The trier of fact looks at your opinion, looks at your ball, and if your opinion is not a yellow ball, it's not a substantial opinion, then the ball is tossed even if it's a good ball. Even if it's a good ball. The opinion must first qualify as a substantial opinion before it can be used. In order to qualify your opinion either for or against industrial cumulative trauma injury, it must meet a few criteria. Number one, your opinion must be based on reasonable medical probability, and you predicate your opinion on reasonable medical probability by simply stating in the body of your report, in my opinion, within reasonable medical probability. And then thereafter, whatever your opinion is, you have to make sure yourself that there's a 51% or greater likelihood that that opinion is accurate, that that opinion is true, that that opinion is applicable based upon the facts of the case. So you predicate your opinion on reasonable medical probability. You predicate your opinion on an adequate history as provided in the medical records and as clarified by Mrs. Smith. This is where you obtain the information regarding the workplace exposure and the details regarding the level, the frequency, and the duration of the repetitive physically demanding activities that Mrs. Smith is claiming have resulted in a cumulative trauma injury. So it must be based upon an adequate history both as provided in the medical records and as clarified by Mrs. Smith. It must be based upon an adequate physical examination. So you predicate your opinion based on your physical examination of Mrs. Smith as the Qualified Medical Evaluator, and you better make sure that your physical examination exactly comports and complies and follows the examination procedures that are described in the AMA guides. And then finally, you make sure when you review your opinion and conclusion, either for or against industrial injury, whatever it may be, that there's no speculation, no guess, no conjecture, no surmise involved. And many times we do speculate. Many times we do conjecture. And if the judge sniffs any hint, any smell of conjecture or speculation, then the opinion simply won't qualify as substantial medical evidence. So your job as the Qualified Medical Evaluator is to clean out from your opinion or conclusion any of your conclusions that are based on speculation, and make sure that all of your opinions or conclusions are based upon adequate facts and reasons obtained from the history and from the physical examination. And if you can successfully compose your opinion either for or against industrial injury, and compose it and comprise it based on substantial medical evidence, then that opinion can be used by the trier of fact in opining whether or not the examinee qualifies for workers' compensation benefits for a cumulative trauma injury claim. So doctors, I hope this helps you. This is a lot, I know, and this is not a complete course on industrial causation for cumulative trauma injury claims, because that course in and of itself would take also 6 hours to just basically even just scratch the surface on all of the considerations that we as qualified medical evaluators need to incorporate into our complex medical decision making. So I hope this helps you on your very next evaluation. Certainly the next 10 of your evaluations, 6 of them are going to include denied cumulative trauma injury claims. So these are some concepts and some ideas that you can rely upon when it comes time for you to provide those difficult determinations related to these complex and sometimes confounding species of industrial injuries. So this concludes our program on cumulative trauma and the QME. I want to thank you for your commitment to excellence as a qualified medical evaluator, and I want to thank you for sticking with me through the end of this program. For now, this is Dr. Perry Carpenter. I look forward to being with you on future programs as well, and I'm wishing you best of success in your career as a qualified medical evaluator.